So the last thing I want to ask about that I think is probably the most important question, because patients, I know when I talk to patients, they get obsessed with PSA. Like, what's my PSA, and is it supposed to be, how high is it? And, because once they hear from their doctor when they go into, their family practitioner, whoever they're getting their PSA test, that the PSA is rising, that's a major red flag, and that's usually when they call us. So when it comes to brachytherapy, where does the PSA, you were mentioning that the PSA doesn't nadir down to zero like surgery, so what numbers would the PSA be? And obviously I would imagine that depends on the size of the prostate.
It does. I mean, ideally we'd like to see the PSA go down to less than 1 and stay there.
Okay.
However, patients who have larger prostates, it may not be that low, and there's some mystery to it that I don't quite understand. But it takes several years for the PSA to go down to its lowest level. We call the nadir in some cases. And that has to do with prostate cells tend to turn over very slowly. They don't divide quickly like mucosal cells or blood cells. So you don't see things, the injury that has happened, you don't see it. And they continue to function while they're still not dividing. So the time it takes for the PSA to go down can be quite long, and during that period there can be some inflammatory changes, so you see the PSA bumping up and down. A benign bounce or a spike is very common, so you'll see it. Somebody might have a PSA of 12 and then it goes down to 2 and then it goes down to 1, and then 18 months later, all of a sudden, it's back up at 3, and now they're all concerned that their disease has recurred. Well, that happens in about half the cases. So I have to tell the men, just kind of stay calm, repeat the PSA every 3 months, and in almost every case, the PSA eventually went down and stayed down. Now, there are a few percentage in the cases that we properly selected for this treatment approach where they failed treatment, and of course their PSA eventually continues to go up. I try and tell the men that if the PSA is in the range of 5 to 10, it doesn't really make that much difference when you start systemic treatment, the salvage treatment, so don't get too excited about it. Chances are this is a bounce. If it's not a bounce, we will address it effectively, figure out whether the disease is persistent in the primary, which happened in only 1 out of 448 cases that we were able to document disease in the prostate, so it's highly effective. There might be disease someplace else. So most of the guys I'm telling not to worry and to wait and let's just see how things go. A few of them we have bad news and we have to address it. Fortunately, we have highly effective therapy that Dr. Scholz and the group know very well how to train.
Right.
Yeah.
Right. So if you would like more information about anything we talked about, you can go ahead and contact our helpline team and they will be available to talk to you. The number is at our website, PCRI.org, and you can look up other information on prostate cancer treatments. And if you like this video, go ahead and give us a thumbs up. The reason those thumbs up matter is because that lets Google know that this video is helpful to you and it can help other patients, and we get on a suggested video list. Subscribe to our YouTube channel if you would like more information in general about prostate cancer. We cover every topic we could possibly think of, and we hope you have a great week.